is a polypectomy performed to remove colon polyps? A polypectomy is an important procedure for removing colon polyps, which are abnormal growths that can develop in the colon. These polyps can sometimes lead to colon cancer if not addressed. The most common way to perform a polypectomy is during a colonoscopy. This is a procedure that examines the large intestine using a colonoscope, which is a long, flexible tube with a light and camera. First, the patient is positioned comfortably, usually lying on their side with their knees drawn up. The doctor gently inserts the colonoscope through the anus and advances it into the colon. To get a better view, the colon is inflated with air or carbon dioxide. This helps the doctor see the walls of the colon clearly and identify any polyps. Once the polyps are located, the doctor can decide how to remove them based on their size and type. For small polyps, which are less than 5 millimeters, the doctor often uses biopsy forceps. These are small pincers that snip off the polyp without using heat, which helps prevent damage to surrounding tissue. This method is known as cold forceps polypectomy. For larger polyps, a technique called snare polypectomy is usually employed. In this case, a thin wire loop, or snare, is placed around the base of the polyp. The doctor tightens the wire and applies heat to cut through the polyp while also cauterizing the tissue to minimize bleeding. If the polyps are particularly large or complex, more advanced techniques may be required. Endoscopic mucosal resection, or EMR, involves injecting fluid under the polyp to lift it before removal. Endoscopic submucosal dissection, or ESD, allows for the removal of the polyp in one piece by carefully dissecting it from the layer beneath the mucosa. In rare cases, if the polyps cannot be removed endoscopically, surgical resection of part of the colon may be necessary. After the polyp is removed, the doctor inspects the area for any bleeding or complications. The tissue from the polyp is sent to a pathology lab for examination to determine if it is benign, precancerous, or cancerous. The recovery process from a polypectomy is generally straightforward. It is often done on an outpatient basis, meaning patients can go home the same day. While some may experience mild cramping or slight bleeding, serious complications are uncommon. Follow-up colonoscopies are typically scheduled based on the results from the pathology report and the characteristics of the polyps to monitor for any new growths. In summary, a polypectomy is a vital procedure for maintaining colon health and preventing colon cancer. By safely removing polyps, doctors can help reduce the risk of cancer developing in the colon. The choice of removal technique depends on the size and type of polyps, with the goal being to completely remove them while minimizing risks. Regular screenings and timely polypectomies are essential strategies for reducing the risk of colorectal cancer. Always consult with a healthcare professional for personalized medical advice.